There are a lot of important changes that are coming in 2025 as it pertains to the Part D prescription drug coverage that you currently have. So most of you today are on a Medicare supplement, also known as a Medigap, and you have added as the third card in your purse or wallet a prescription drug plan. So today's presentation is going to get you up to speed on the prescription drug plan changes, which are a direct result of the Inflation Reduction Act. Keep in mind that this is strictly an educational seminar. And there'll be no plan-specific benefits that will be discussed. I'll probably refer to them a little bit in general terms because I have a pretty good idea based on our listeners today who's got what. So I probably will refer a little bit to what is out there in terms of the plan considerations. Most everybody should have now received their Medicare and You book. And if you do look in the back of the book, you will see all of the prescription drug plans that are available for 2025, as well as your Medicare Advantage plan and other related plans associated with Medicare. So today, without further ado, we have our team. On the left-hand side of the diagram, on the left-hand side of the picture is Becca. Becca is actually the one helping me today. And she recently was licensed, has her health and life license. Right now, primarily is working in an admin role, scheduling appointments, but she will also be following up with requests for reviews for the prescription drugs. So don't be surprised if you do hear from Becca and that she has a recommendation that she will go through with you, as well as Kristen, Amy, and Nancy. So we're all going to be helping out with the prescription drug plan changes this year. Kristen, in the middle there, has been with us for several years, and Amy, alongside her on the right-hand side, both have potentially worked with you in the past, perhaps last year or the year before in the event I was not available. And I must want to thank you all for the many, many years that we've been together. It's almost been 20 years for me that I've been helping people with Medicare. And along those same lines, I knew several years ago I needed to build my team, hence Becca, Kristen, and Amy, so that when it came time for open enrollment, if you wanted to meet with us, there would be someone available. We have well over 1,000 clients now in the 20 years that I have been doing this. So I know they will do equally as good a job for you. Keep in mind that the annual enrollment period technically started on the 1st in terms of information being available out on Medicare.gov. You also have received an annual notice of change, or should have by now, from the carrier or insurance company that you currently have your prescription drug plan with. We cannot physically make any changes until April 15th, and we're going to talk about what that might look like. So the changes there, and I see we have an error there because it goes from 10/15 to 12/7. It's not 10/7. It should be 12/7 is the end date for making any changes to your prescription drug plan. And again, if you make no changes, your plan will automatically renew. I want to talk about the Part D landscape and tell you that, as mentioned previously, this is the first year I have seen as many changes, such as premiums that have gone way up, premiums that have gone way down. We have seen changes in the formulary. We have seen changes in the tiers. We have plans that we as an agent are no longer being compensated for. That's the first time I have ever seen that. So more than ever before, it's important to evaluate your prescription drug plan. in relationship to your Medigap plan. So remember, your medical insurance is through your Medicare supplement or your Medigap, and you add a Part D to that. So I know when we meet with people, you need to look at the big picture. Everybody pays for Part B. We have not seen what that new number will look like for next year yet, but you're always looking at what do I pay the government, which is the Part B, what do I pay for my Medigap, and what am I paying for my prescription drug plan. Today's topic, Inflation Reduction Act, we're going to dig a little bit further into that. It's going to be a real benefit for those people that have had real expensive medications in the past. They now have a prescription payment plan for those people that have spent big dollars in the past for their prescriptions. We've got some analysis tools that you can use. We're going to share with you what we do and some of the tools that you can use on your own. And then we'll open it up for questions and answers at the end. So this diagram, if you've met with me in the past, is very, very familiar. I still refer to the left side and I refer to the right side. You are on the left side. We're talking about the prescription drug plan once a year that you can change. The Medigap supplement, most of you have Plan F as in Frank, Plan G as in Go, or Plan N as in Nancy. And yes, you do spend more money than the person in option number 2 or on the right-hand side, because you have said that there are some things important to you. And maybe even the first decision you made was when you came aboard, you had what's called guarantee issue. No plan called a Medicare supplement with any carrier could deny you any kind of coverage. We think of the left-hand side as paying up front for the possibilities of needing any kind of care and coverage with virtually no out-of-pocket. Whereas on the Advantage plan side, you may have a very low or no premium, but you will be paying along the way in terms of your copays. So you have original Medicare Part A and Part B. You also have secondary insurance and you have a prescription drug plan. Just as an aside here, I had someone last week call and said she got a brand new Medicare ID number. And I'm like, really? Come to find out, because of some of the problems with theft and identity, fraud, et cetera, somewhere along the line, they made a decision to replace her Medicare card. It was legitimate. So she retained the same Part A and Part B, but clearly she had a brand new Medicare ID number. So there's a lot of funny business out there, but it did happen in her particular case. And she did have a letter that went on to explain it in more detail from Social Security and Medicare. So again, you've chosen the upfront option. The downside is it does generally go up once a year. Sometimes I've heard it goes up more than once. They're looking at you turning a year older and the cost of living, which is one of the factors in determining that rate increase. And they have been more than usual. When I meet with people today, I tell them plan on at least 10%. In some cases, I've seen 15 and 20%. And that's very much due to the rising cost of healthcare. And a contributing factor was COVID. So many people had to delay the medical services. And as a result of that, perhaps became sicker. And by the time the treatment was received, they've resulted in more dollars spent, more trips to the doctor, et cetera, et cetera. Another factor was you didn't want to work with a network. It was important that you could go see any doctor that accepted Medicare. You have nationwide travel, anywhere in the 50 United States, works like a charm. And you also have some limited international coverage. Keep in mind, you can always revisit your Medigap plan, but the determining factor is the medical underwriting. So there is not a specific medical exam that's put in place. Nobody comes into your home. We work with you on the front end to determine your Medicare eligibility. Sometimes we work with the underwriter based on how you answer the questions as to whether or not you might be a likely candidate for revisiting your Medigap. And as I've said before, Medigap is very much like the cable company. Once they've got you, it just keeps going up, going up, going up. But don't hesitate to ask us to look into it for you. We will send you some questions and see about the possibilities of moving forward. That Medigap can technically be revisited at any time of the year. It is not subject to open enrollment, but we do ask that you postpone any visit for this fourth quarter because our emphasis really needs to be on the annual election period or open enrollment. If you do decide to revisit, you can either say with the same insurance company or a different one, but it is subject to the medical underwriting. So let's talk a little bit about Part D. This plan has been around, or this part of Medicare has been around since 2006. I came aboard in 2005, and I do remember this very well. There were people at that time that didn't sign up. And unfortunately, those folks have faced a penalty. So what's always important is that a person sign up for Part D when they're first eligible. We started out with 4 phases way back in 2006, and we've had these phases for many years since until the introduction of the Inflation Reduction Act. There are 4 phases. Deductible, that still stands for 2025. The initial coverage, that still stands for 2025. In the past, we had the coverage gap in the donut hole. It exists yet this year in 2024. That's when your copay generally goes from $42 a month to well over sometimes $100 because the person is now in the coverage gap, also known as the donut hole, and they pay 25% of the retail value of that medication. The catastrophic level was removed this year, 2024, and no longer does anyone pay anything else in out-of-pocket expense. The cost sharing itself has been passed on by the member, you paying, me paying, the plan paying a portion of the cost associated with Part D, as well as the manufacturer, pharmaceutical company, and Medicare is also a contributing factor to the overall cost. Every year, we've encouraged you to revisit your prescription drug plan because there are formulary changes. They drop prescriptions, they add new ones. Tiers, remember tiers 1 and 2 are the least expensive. Tier 3 and 4 tend to be brand name tiers, brand name medications. And then we also have specialty tiers at tier 5. And sometimes tier 6 is actually not a specialty tier, but they have carved out a special tier for commonly used medications. And of course, there is cost sharing that's associated with all of this as described above. When it was introduced in 2006, there was no negotiation with any of the drug manufacturers or pharmaceutical companies. Why not? I don't know. But the government got back involved, especially when the donut hole or coverage gap, when it was first introduced, the person paid 100% for the cost of that medication. So the government got involved, went back and said, we're going to be making some changes here, and that's primarily what we're going to talk about. There have been a few changes already implemented, one of which was the insulin at $35. So just to keep in mind, there are 2 types of medications or drugs, if you will, in terms of their categorization by Medicare. The first is prescription drugs, Part D as in David. These are drugs that are primarily administered by you, okay? And they are pills or capsules. You've gotten a prescription from your doctor. They call them into a pharmacy, or you set it up for some type of 90-day prescription, perhaps with a mail order facility. Shingle shots are also now covered under the prescription drug Part D. We do have Part B. So Part B are drugs that are given by a doctor, a hospital, or an infusion center. Tend to be insulin used with insulin pumps, oral cancer drugs, renal dialysis drugs, flu, pneumonia, and hepatitis. And again, often when we would talk about Part B, when we met, one of the big concerns often had been chemotherapy. So that's that oral cancer drug that's listed here. Person goes into an infusion center. Medicare Part B today is 20% of the cost of the chemo. Medicare pays 80, you pay 20, except your Medigap supplement has picked that 20% up altogether. There are also some other folks that have had Remicade, that's another type of infusion for arthritis. And there are other drugs like that that treat medical conditions. And that's why you have chosen Part B. Your plan picks up the 20%. Some drugs may be covered by either a Part B or a Part D. So sometimes we need to do a little bit more research. Often it's how the drug is administered. And then lastly, Part A does cover drugs when you are an inpatient in a hospital or a skilled nursing facility. It does not go through D, it does not go through B. It all gets billed through Part A, except when you get ready to leave the hospital and they give you a script and you go fill it, now it becomes Part B. So the Inflation Reduction Act, how they ever gave it this name remains to be seen because it doesn't really tell you much about what it really is. This is only a small portion of the act as it pertains to Medicare. So what we've got going on here is we are going to eliminate the coverage gap altogether. We're going to limit our drugs to $2,000. And this slide primarily is telling you that it impacts all of the prescription drug plans. Eventually, it will affect the group plans where people are still working and they have prescription drug coverage, but that's actually been postponed to next year. And most of you have the standalone prescription drug plan. And those that have Medicare Advantage plans are also impacted by this drug benefit and change. And as a result of that, as I mentioned earlier, with premiums that have gone up or gone down and tiers changed, the Advantage plans also saw changes where there might have been benefits that have been eliminated. There are plans that had gym memberships, they've come off. There are plans that have had pop-up pals helping people in their home. It has been eliminated. So the Advantage plans also have had to say, okay, we include the drug benefits, but now how are we going to afford everything, knowing we have the one-stop shopping, but we're also required to keep the prescriptions on our plans to no more than $2,000. The changes started in 2023 and they will continue through 2032. So the big changes, there is no donut hole. It is going away altogether. There will be limits on the annual out-of-pocket drug costs to no more than $2,000. The plan that you have today or the plan you have in 2025 will be charged with keeping track of the cost, just like they do today. All the Part D plans will be offering a prescription payment plan. We're a little nervous about that, and I'll tell you about that in a moment. And all Part D plans and the drug manufacturers or pharmaceutical companies are required to cover more of the drug costs than ever before. So the three diagrams here in front of us, there's our $2,000. What you're going to see if you've looked at your Medicare and You book is that the vast majority of plans, of which if I counted correctly, I want to say that there are 14 plans, which are a lot less than there were for last year. There were a few carriers that decided not to participate at all. And there were a few carriers or insurance companies that said, I'm not going to have 3 plans. I'm only going to have 1. or I'm going to have this plan, but I'm going to change the name. Again, lots of changes, but the cap is $2,000 for all of your medications, but it does include the annual deductible. The annual deductible on the vast majority of plans in 2025 is $590, and that is the retail cost. The $590 is one of the reasons for the prescription payment plan that's coming up. We've had people who have said, not only can I not pay the $590 and then I have to pay for my prescription, I just simply don't have that kind of money when I show up in January at my retail pharmacy. So once you hit the $2,000, if that's you as a candidate, and those are things that we will help you determine, and many of you know already where you stand with that, because you do get every month from your prescription drug plan a list of exactly where you are with one of those 3 phases that I mentioned earlier. No more donut hole coverage, and that prescription drug plan payment plan is coming up. Again, here are my new phases. I really think there's only 2, because you have a deductible that applies primarily on all the plans next year. We have phase 2, and this is where you're paying. So you've got copays. Remember, your copay is a fixed amount. Remember, there's a big difference between going to a preferred pharmacy or by going to a standard pharmacy. You always want to make sure you go to a preferred pharmacy. So there are copays that vary based on which pharmacy you go to. More plans this year also at tier 3, instead of having a copay, a fixed amount, they have a coinsurance amount. And what that means is that's a percentage. So you're paying a percentage of the retail cost of that medication. And the costs of the medications, they change. They change on a daily, weekly, and monthly basis. So there always is a little concern over, gee, I went into the pharmacy and one month it was this, and the next month it went down. And then the next month it went up. Well, that's because the person has a coinsurance that's applied to a retail price that changes. So the retail price is negotiated between the plan and the pharmacy, but it does change. So beware of a coinsurance. Doesn't mean you can eliminate it, but at least understand how it works. And again, the plan you choose, they will keep track of the $2,000. Phase 3 really is once you hit the 2,000, you're in catastrophic, and you don't pay anything in the catastrophic level, there we go, until the next year. So remember, all your drug plans start January 1st and they go through the end of the year, 12/31. If any of you move, I've got a few folks that are moving to Florida or Arizona. You can only keep your existing plan from Michigan for 60 days, and then you must find a new plan, and we are happy to help you do that. We do not have licensing in all states, but we also have a business partner who will help you. First, we'll help you, but then we'll contact them and they will help you enroll in a plan in the new market that you might live. But as long as you stay in Michigan, even if you move from Grand Rapids to Kalamazoo or anywhere else in Michigan, your plan will continue to work. So here's a comparison of the two. In 2024, our annual deductible was $545. It's gone up to $590. This year, the initial coverage was at $5,030 in total drug costs. Next year, it will be $2,000. So you can see it's had a pretty dramatic effect in a positive way, certainly. But as a result of that change, the costs have been passed on, and they've been passed on to all parties here, again, including us as an agent. And I'll speak a little bit more to that later on. So the key to remember here is if your drugs are less than $2,000, you'd still want to make sure you're in the right plan. Either you'll do the analysis or we will do the analysis for you, and there are fewer plans to choose from. here's that payment program. And again, we're a little nervous in terms of how this is all going to work. And when we get to the questions, if I don't have answers, I certainly will get you answers. We still have a lot of questions. But here's the general idea. The general idea is the drug plan itself or the insurance company, and I'll throw some names out. We're talking about WellCare. We're talking about Aetna SilverScript. We're talking about United Healthcare AARP. We're talking about Blue Cross Blue Shield. Mutual of Omaha has exited the market. So if anybody has a Part D with Mutual of Omaha, we definitely need to be talking to you because they chose not to participate for next year. We also have Humana. These companies are part of the prescription payment plan, and they work directly with you in the event you become a candidate for this program. We best determine that based on what it looks like the first couple of months of the new year and what you might be spending. We're being told that if somebody has a $600, let's show up to the pharmacy counter in January and or February, they might want to consider the payment plan because this is strictly optional with the idea of spreading the payments out. But it's the insurance company that will sign this person up. It is not the pharmacist. So when you go to the pharmacy, if you're a candidate for the program, they will not fill your prescription unless you have worked with the drug company that you have made a decision to stay with or go with. Those of you that stay in the same plan for next year, who have medications that are estimated to be more than $2,000, they have told us they will contact you directly with information and your ability to sign up. And again, it's only optional for this payment plan. They are also required to do all of the follow-up in terms of collecting the co-pays and the co-insurance. So you're going to get a bill from them. And they're going to tell you what you owe for January. And then they're going to tell you what it's estimated to look like for February, March, and the balance of the year. And I thought it would be as simple as, well, let's just take 2,000 and divide by 12. And okay, that's what I'm going to pay. It's not. It's much more convoluted and complicated. It'll all still work out because you're still not going to pay more than 2,000. But at this point, I can't tell you really what the rhyme or reason will be because they're going to look at your meds. They're going to look at how often you fill them. Maybe you don't fill them every month or you don't fill them every 90 days. So all those values change. But in a nutshell, when it comes to the end of next year, you're not going to have spent more than $2,000. They also are responsible for all the collections. So if somebody doesn't pay their invoice, they're going to give them a grace period of time. And then if they don't pay, they're going to drop them from the prescription payment plan. They're not going to drop them from the actual Part D plan they're in. But the company is going to say, you know what, I'm not going to deal with the prescription payment plan. I'm not going to spread these payments out. I'm not going to send them invoices. They're going to have to pay when they go to the pharmacy. To continue. Enrollment in the plan, they often refer to this as M3P. I'm sure it means something as an acronym. P, I'm sure, is plan. I'm not sure what the M3 is, but anyway, it is optional, like I say. If you don't have a lot of medications, this is just FYI for you only. So those that would most likely benefit, as I mentioned previously, they're going to probably have costs of $600 or more. And that $600 could be inclusive of the $590 annual deductible that most of the plans have. And it does not include, today anyway, any Part B drugs that I mentioned earlier, or any medications not on the formulary for the plan. So again, that's why it's important that you know whether your medication is covered. Some medications can be bought over the counter. Some can be purchased through other resources like discount savings programs and so on. You must opt in each year. You can opt in or out anytime during the year. And for those that do opt in, as I mentioned, the insurance company will distribute their prescription costs over the year, but it may not make a whole lot of sense until you see that first document. So they're going to send you something and they're going to extrapolate some numbers and they're going to show you what the estimated invoice is going to look like based on how you fill your scripts every month. So February, it's this amount, March, it's that, April, and so on. So we do have some enhancements that are forthcoming. These are all great enhancements. The government went back to companies that had no competition and their patents weren't expiring and there were no generic equivalents at the present time. So those companies are going to be faced with reducing costs on Eliquis, Xarelto, Januvia, Farxiga, Entresto, Enbrel, Imbruvica, Stelara, Fiasp. I think that's got to do with diabetes, the Novolog, and so on. So these changes don't come into play until 2026. Now, maybe we'll see something in 2025, but 2026 is what you want to be looking for if you're on any one of these kinds of medications. They're going to continue that negotiation with the pharmaceutical company, manufacturer, and take 15 drugs in the years 25 and 26, a brand new 15, and they're going to be looking at B and D drugs. And then in the years 27 and 28, they're going to take 20 drugs and they're going to be doing the same thing and negotiating better values for everyone. So what do you want to expect in 2025? You're going to have higher premiums, potentially, although I looked at a few and they were actually lower. You're going to have fewer plan choices. I think we have 14, if I counted correctly, in the back, strictly for Part D standalone plans. Stricter formularies, again, a reason to look at your medications. We're going to have drug utilization reviews. There might be more prior authorizations that are required. There might be step therapies. And again, step therapy means, hey, there's a lesser expensive drug. We want you to try this first. If it doesn't work, your doctor's going to notate that, and then you'll be able to move to the medication that perhaps works better for you. But it's all about cost, and quantity limits might be. Every medication has a certain number of quantity associated with it. Do you take it 1 a day, 2 a day, 3 a day, so on and so forth? As mentioned, the Medicare Advantage plans, they didn't escape anything. They also had their plans redesigned. So we are encouraging every Advantage plan holder also to do some of their due diligence by looking at their annual notice of change. And your annual notice of change shows you what the 2024 is versus the 2025. Those folks are going to be doing the very same thing, seeing what benefit changed, what went up, what went down, what did I lose, so on and so forth. So we have really stressed this year more than ever to review your Medicare because of the changes that I've just talked about. So let's talk a little bit more about an analysis and review, and then we're going to just show you on YouTube a video, a portion of it, which would help you if you want to do some of your own self-analysis. So what I want you to know is we are here. What has been difficult for us is to find out that 2 of the plans that we have many clients in are offering no commissions whatsoever for next year. They're not even paying for people that have renewed. I can understand perhaps if somebody's brand new, but are you serious? We probably have at least 400 people that we will receive no commission for when they renew their plans. So we've had to look at making a few changes in terms of our process. So the first is we've asked you to give us an updated list. We're using a new tool called Retire Flow. We send you a link. Many of you have sent that information in. We've also asked for the scope of appointment, which is required for any kind of discussion on the phone or in person. So that was new. With this information, we can do an analysis for you. And my point is this. We are going to be doing more phone reviews for the prescription drug analysis. It's a more efficient use of our time. We're hoping it's also a more efficient use for you as well. We're going to document things. We're going to walk you through it. We're going to use the drug list that you gave us. We're going to look at the pharmacy, and we're going to tell you why we think you should stay in the same plan or why we think you should move to a different plan. And we're going to stress the importance of the pharmacy that you choose as well. I'm going to show you Medicare.gov. It is a tool that you can use. It is also a tool that if you choose, you can actually enroll online. So the two companies that we do not receive any commissions for this year are WellCare and the Aetna Silver Script plans. We have many people in WellCare. We are more than happy to tell you, stay in the WellCare plan, and this is the reason why. We cannot service the WellCare plan going forward. As an agent, they have removed even the service capability for WellCare as well as for Silver Script. So what that means for you is if you stay in WellCare, and we will tell you why it might be the best choice, you're going to need to work directly with WellCare, and it will automatically renew so you don't need to do anything. If we end up talking with people and we refer them to WellCare, because one of the plans out there, and you probably know who you are out there because you've got what was a $5.30 a month plan that just went up to $28.30. If WellCare becomes the best option for you, we're going to recommend that you enroll in WellCare. It's easy to do online. We can do it for you, or you can do it with this tool that I'm here to show you about, okay? So there will be situations where clearly we're going to get paid for the work, but most importantly, we're going to work with you. We want you to work with us as well, recognizing what the situation is here, helping you use the tools that are out here. You all have access to a computer because you're on the webinar, okay? And in the past, I have helped people use the Medicare.gov tool. And sometimes they've just called to say, you know what, I use the tool. I think this is the right choice. Do you agree? And we, again, are more than happy to say, you did it absolutely right. This is where you want to stay. A side note about WellCare. WellCare has a tendency to want to move people to Medicare Advantage plans. Now, I'm not saying they're the only one. So the word of caution in general, and you've probably are already getting those phone calls. You're already getting stuff in the mail. You're already getting little postcards that you're due all these extra benefits, so on and so forth. Is beware, because they have a tendency to try to talk you into a Medicare Advantage plan. Now, I'm not saying that an Advantage plan might not be the right choice for you. We did have a previous presentation. If you would like us to send you that, you can listen to it. You certainly, again, can call us. What we've said is this is a time of the year where we're devoting our time and our resources to Part Ds and those people that have Medicare Advantage plan. And by having the previous seminar, people did come. Many of them said, I'm going to stay right where I'm at, okay? But now is the time, if you really think you want to look at the Medicare Advantage plan, we need to know that so that we can walk you through what we would consider the analysis as well. So next is going to be Becca helping me, and we're not going to play the whole thing because it's 17 minutes worth. And you don't need 17 minutes, but it will just at least get us started. It wants to run away.
Finding a plan has never been easier thanks to Medicare Plan Finder. You can find and compare plans in your area, see your options, and join a plan that best meets your needs. Plan Finder shows estimated costs based on the drugs you take and pharmacies you choose to help you compare plans. And using your online Medicare account makes it faster to add or change your drug list and join a plan. Let's get started. First, visit medicare.gov/plan-compare. If you're new to Medicare, we recommend selecting first time joining a Medicare health or drug plan before starting your search. You'll answer a few questions that will help you understand what type of plan you want, when to shop for plans, and how to avoid late enrollment penalties. Remember, you'll need Part A, hospital insurance, and or Part B, medical insurance, before you can join a Medicare health or drug plan. When you're ready to search for plans, select Login to access your Medicare account. Logging in gives you an easier, more personalized experience. If you don't already have an account, select Create one. You can also find and compare plans without logging in by entering your zip code and county and then selecting Continue. But remember, if you search for plans as a guest, Plan Finder won't know if you're currently enrolled in a plan. This means you won't automatically get your current plan's information when you search. To get more specific cost estimates, you'll also have to enter any prescription drugs you take and your preferred pharmacies each time you search. To log into your account, enter your username and password, then select Login. After logging into your Medicare account, you'll go to a summary page with your name and current plan. You can scroll down your summary page to find other information like the plan name and application number if you've applied to join another plan, any extra help you might be getting with your drug costs, your saved pharmacies, and your prescription drug list. During open enrollment, October 15th through December 7th, you can preview what your current plan will look like next year if you don't make a change. Select Compare Plan Details to get a side-by-side overview of your current plan and next year's updated version. If next year's plan details aren't available yet, you'll get a message telling you to contact your plan for more information. You can compare things like deductible amounts, customer ratings, and estimated costs for different items and services. Remember, drug cost estimates are based on your saved drug and pharmacy lists, so it's important to keep those lists up to date. We'll talk a little more about those lists now. Let's go back to your summary page. Let's look at the pharmacy list first. Adding pharmacies helps us give you better estimates of your prescription drug costs. If you haven't logged into
Skip to 6 minutes. So this part is just about how to enter your pharmacies, but we're going to skip ahead to talking about adding your drug list and keeping that updated. So go to 6 minutes.
Okay.
Yeah, that's about it.
Okay.
on your summary screen, you'll come to your drug list. If you haven't logged into your account recently, you'll get a message reminding you to update your drug list with any prescription drugs you currently take. In this example, we haven't added any prescription drugs yet. You can select Add a Drug on your summary page to start the process. On the next page, you can select Add a Drug again to search for prescription drugs you currently take and add one or more to your saved drug list. Let's add a drug now. Begin typing to find your drug's name. You can also use the Browse Drugs A through Z feature to find your drug. Let's add Lipitor, a drug that's used to treat high cholesterol. We'll type the first few letters of the drug name and then choose Lipitor when it appears in the drop-down menu. We'll then select Add Drug. If your drug comes in a generic form, you'll get a message asking if you want to add the generic to your list or keep the brand name. Select either Add Generic or Keep Brand, depending on which version you want to add. We'll keep the brand version. Next, add more information about the drug, like the dosage, quantity you take, and how often you get the prescription refilled. Select Add to my drug list to save this drug and return to your drug list. If your drug list is missing a drug you take regularly, you can select add recently filled drugs to get a list of all the prescriptions you filled in the last 12 months. Check the box next to each drug you currently take. Or, if you take all the drugs shown, just check the top box to select all the drugs. Remember, don't include drugs you take temporarily, like an antibiotic. If you check a box by accident, it's fine. Just select it again to uncheck it. Having an accurate drug list will help you better estimate your costs and find the lowest cost plan. We'll add one of the drugs on the list, Nexium, and then select Back to My Saved Drugs. Once you've added all your drugs, select Done Adding Drugs to go back to your summary page. Now that we've reviewed the information on your summary page, we're ready to search for plans.
The rest of the video actually talks more about Advantage plans than the Part D plans. But if you do want to watch this on your own time and learn more about how to look at them, then the benefits and all the costs will be listed as well. And feel free to look at this on your own time. We're going to go back to the presentation now. There you go.
Okay. So just to add a little bit more to that, Ron and I are both on Medicare. We did set up a Medicare.gov account, and it really does work pretty well. Okay. So I've already kind of gone out there to determine whether Ron and I need to make a change. And it looks like we can stay in the same plan. So it'll bring up the existing plan. And then I made sure I knew which drugs that we wanted to bring forward into 2025. And then it will show you a list of the available plans. It will also show you an estimation of the total cost out of pocket that I'm going to spend or you're going to spend in copays and coinsurance. And then I compared to the next available plan. So unless there was something I didn't like about the company that I'm with, it happened to be Humana, I'm staying with Humana. There was no reason for me to look at Cigna or any reason for me to look at United Healthcare because it would have all cost me more overall for the balance of the year. And again, it takes a little bit of effort. We are here to help you, even if you sit in front of your screen and you say, you know what, I'd like you to walk me through it. We can look at it with you and we can show you and help you discern the information. But really, overall, it's pretty self-explanatory. You can look at a list of your medications that you've input. It's going to show you what tier it's on. It's going to show you whether it has a fixed expense. Is it a $0 for the tier 1 for 30 days? Is it going to be a standard pharmacy and I pay $5? They make it very clear as to whether you have preferred or whether you're into a standard pharmacy situation. You're also going to see with the, it's kind of a forecast. It will show you whether you have to pay anything towards the $590. So most of the plans don't make you pay from tier 1. Now, that's not true for all of them, but I know in the plan that I have, my tier 3 is when they started to talk about gathering the retail price of the medication towards the $590. So just keep in mind that when you look at how they forecast, because they'll show you, this is what you spend in January, this is what you spend in February, this is what you spend in March. You'll be able to see how the values start to change. And if you see some big dollars in January and February, you're probably, again, satisfying the annual deductible. If you don't want to set up an account and you only have a few medications, I get it. You can go out to Medicare.gov. We do this all the time for somebody just on the fly. You put in your zip code. It might ask you if there were multiple counties. Pick the county that you live in. Put the medications in, whether they're generic, whether they're brand, pick the pharmacy that you would go to, hit the button, and again, it's going to do the very same thing. It's going to list them with the lowest overall price associated with either do I have to pay a portion of the deductible? That's factored into the overall amount that they give you. And then they'll add in the copays if you fill it every month or the coinsurance, like I said. and you'll get an estimate. But you will literally have a list of where you can see them lined up, insurance company by insurance company, with the values associated with them. Okay, so we'll wrap it up here and open it up for questions. But again, we had a typo here. Boy, I can't believe I missed this one too. Other resources to lower the drug costs. Doctor samples. I had somebody last week. He said, you know, I'm coming aboard in November. He said, I'm going to get some samples for November and December so I can avoid paying that $530 annual deductible. He'll pay it next year, but avoid it for this year. The Canadian Med Store, interestingly enough, is actually in Florida. They're not here in Canada, although there are Canadian pharmacies. And we do have brochures on the Canadian Med Store. They're located in Altamonte Springs, Florida. But they also will provide a discount on some medications. Keep in mind that anything bought outside of the Medicare system with your Part D does not count towards the $2,000. You've saved money, but it doesn't count. And again, if nothing is on the formulary, it's not a covered medication, and you pay for it, it does not go towards the $2,000. There are also prescription drug cards, or discount cards, I should say. GoodRx, big one. Many of you have heard of them. There's also Single Care, and there's Optum RX. So if you've not heard of either one of those are other options for you to consider. Again, when I go to the pharmacy, my pharmacist does not offer up looking into GoodRx, Single Care, or Optum. So I either ask him when I'm at the window, especially if it's a one-off, and I'll say, you know what, I can see over here I paid $28, but if you've got access to these discount programs, which I know they do, could you please run it through there to tell me whether it's going to be 28 or can you find it for 18? So some pharmacists will automatically do that for you. Others you have to ask, or you can go out onto the website for either one of these three options right here. Plug in your prescription name. And then I know in the case of GoodRx, which I have used myself, you can either download the app and then show them the coupon, or you can print the coupon out, whatever is going to be easiest for you. But those are always options. Nobody says you have to use your drug plan, other than you need to be in a drug plan to remain credible and compliant. So here's the actions, some of which we've already mentioned so far. Please review your annual notice of change. If you don't take any medications and you're in the WellCare Zero plan, you're probably going to stay there. There's no reason to move you. If you take only a couple medications and you have the WellCare plan, we are more than happy to take a look at it. There are preferred pharmacies and there are non-preferred. If you're okay with the changes on your plan, because you've looked at the annual notice of change, it will automatically renew. Nothing else for you to do. Do your own research on Medicare.gov. There's the Plan Finder tool. What we saw was actually 2023. It wasn't 2025, but the tool hasn't changed. It remains the same. If needed and you want some help, we're going to try to do mostly phone reviews. If you absolutely want to come in and your list is really complicated and you need to see us face to face, we get it. We will absolutely do that. Otherwise, expect a call from a Becca, a Nancy, a Kristen, or an Amy, and we're going to say, this is why we think you should make a move, and we're going to give you an explanation so that you're comfortable. If you do move to a different plan, you'll be automatically disenrolled from the existing plan that you are in. You do not have to call them. They will automatically be notified they were not the plan choice of next year. And again, we're here to give you the comfort level that you need. So for those of you that might have appointments, great. We'll keep them on the books. You kind of know what we're going to do here. If you want to use the Plan Finder tool, and when we talk, say, you know what, this is what I think I need to do, that's great. If not, you have to send us your meds. We actually use a different tool than you do, okay? But it accomplishes the very same thing. Reminder, there's going to be a lot of calls coming from call centers. If you answer them, and they'll keep calling, I guarantee you. Remember, everything is based on where you live. And a lot of times these call centers will infer that you're missing out on something. You probably are not, unless you are on Medicaid, okay? But they infer that, oh my gosh, you should get all that you're entitled to. It's their way of getting you to call them. So they either want to try to put you in a dual eligible plan, or a lot of times they're trying to put you in a Medicare Advantage plan. They really do not want to deal with the Part Ds. The number one complaint has been people talking to some of these unscrupulous characters here and finding out they got flipped to a plan that they never even agreed to. So feel free to say, look, I work with a local Medicare advisor. Thank you very much, but take me off your list. So there's yours truly right here. For some of you, you already know this, but I'm also going to mention this. So Nancy is in the process of transitioning her Grand Rapids location, primarily Western Michigan, to Amy and Kristen. It's time for me to ratchet back a little bit. I'd like a little bit more time for myself. For those of you that might be living up north, I still have that little cottage and I have an office up north, and I will continue to do business and I will continue to help them here in Grand Rapids, but not at all to the magnitude that I have done in the past. I've really made an effort over the last couple of years to build the team, share my values, my philosophies of customer service and being available. So I hope that you stay with us, and we're certainly open to any and all kind of feedback on how to improve service and how we go about doing business.